Peterson, Schwartz,
Here.
Miller,
Here.
Bulow,
Here.
Canuck, and then Rudis.
Here.
Okay.
All right. And then roll call, that was roll call, right? Okay. Our land acknowledgement.
Yeah, absolutely. We are gathered here on lands that were originally home to the Menominee and Ho-Chunk nations. We honor the Menominee and Ho-Chunk communities and are grateful for their stewardship of the land and waters. We acknowledge these ancestral grounds as sacred and remember the complex history of settler colonialism on these lands and the effects that persist today. We commit to a restorative and healing relationship of the original inhabitants and our community.
Thank you, Carl. And then I'll say our mission statement. The mission of the Diversity, Equity, and Inclusion Committee is to create a more welcoming, connected, and equitable Oshkosh by consciously including the richness and complexities of marginalized voices in its planning and functioning. And then do we have a motion to approve the minutes from the March 24th, 2025 meeting?
I will move to approve.
And a second?
I second that.
Call the roll.
Let's see. Schwartz,
Aye.
Miller,
Aye.
Bulow,
Aye.
Rudis.
Aye.
And then do we have any citizen statements for today?
We do not. No one is registered for citizen statements or public comments on the agenda items.
All right, then we have our presenter today, Jennifer Skolaski from the Winnebago County Overdose Fatality Review.
Hi.
Hey, welcome.
Thank you. All right. Thank you so much for having me. Tonight I'm going to talk about the Winnebago County Overdose Fatality Review. I may also use the acronym OFR because Overdose Fatality Review gets a lot for a while. But I'm really excited to talk about kind of the connections about why this is important, the work that we do, how you might be interested and get involved in the future. So I thought I would just start with this lens of why this work is important and why it may matter to the DEI committee. I don't want to say why you think it's important, but just kind of the intersectionality in what we do. So 2023 United States National Survey on Drug Use and Health reported 48.5 million people 12 years or old struggle with a substance use disorder in the last year. That is a lot of people. My guess, if I asked you all, and I won't because we're a small group and I don't want to point anyone out, that you probably know someone struggling with substance use disorder. Whether you work with them, whether they're your family, whether you're a person in recovery, substance use impacts so many of us. And so as we look at how to help our community, it's obviously something we need to address, which our OFR team does. And we do this through a few different ways. The first is obviously through root causes. So we look at how people are struggling, where they're struggling in their journey, and trying to make a difference in some of those root causes that really keep people sick. Because we recognize that addiction is a disease and people are sick and we want to get them better. The way that we do this is by analyzing those individual, organizational, and systemic factors. We look a lot at social determinants of health, and I know you guys do as well. So thinking about where people live, how they are supported, and what we can impact in our community. We have created a lot of programs, and I'll get into it. One of my favorites is this Handle with Care program between law enforcement and schools, and really looking at childhood trauma. And one thing that we focus on is that inclusive approach that strengthens community well-being. So as I said, people struggling with addiction are sick. We want to help all people, wherever they are in their journey and in this community, to strengthening that inclusive approach. And the last is we vision this idea of we heart you. And I'll talk a lot more about that, but that inclusive community where everyone can thrive. So what is an OFR? An OFR is a multidisciplinary approach in looking at someone's life who died from a fatal overdose and looking at how our community can do better to save future lives. We look at, we have a confidential process. We have a lot of multidisciplinary partners that come to the table. We look at all those touch points that someone had and think about what policies need to change, what programs or other interventions could there be to save someone's life. We focus on systems level change, but we also look at those day-to-day occurrences and looking at equity no matter where people are. We have been around for 7 years. I take this picture from the news because I never took a picture of our very first meeting. So we started in April of 2018. We were the second group of grantees throughout the state who did this type of process. And the way we got started was there was the Winnebago County Drug and Alcohol Coalition. Before that, it was called the Heroin Task Force. And now you can think of, have any of you heard of Breakwater? Which is a youth coalition focusing on substance use prevention. But basically, we were able to get funding. This model is a national model, and we were able to get funding along with others in the state to start this process. We are the leader, if not a leader, but I pretty much think the leader of overdose fatality reviews around the nation. We serve as a peer mentor site, so people have come from West Virginia, Washington, Colorado, Kentucky, Texas, all over the country to come see what Winnebago County is doing because we are doing so well. And a huge reason is because of all these people that are on this page. We have 49 partners representing 35 agencies. So it is a reflection of law enforcement, treatment, recovery, public health, healthcare, city county services, education, faith community, people who've struggled with addiction and in our recovery, people who've lost loved ones, people who are raising loved ones, all different backgrounds, all different perspectives. And what drives us is this graph. So we're actually working on our annual report, and I'm really, really, really proud to say that we saw a 49% decrease in fatal overdoses last year. You're the first ones that I've shared this with, so hooray. Yay! People around the country have seen about a 30%, so this is much larger than that. With that said, 24 is still too many. You know, that represents individuals who are your neighbors, your family members, your friends. And this number doesn't even touch all of those who have had non-fatal overdoses and people who are still sick, people who are still struggling, and families who are supporting or struggling as well. In digging into some of the demographics, so sex, gender, and race, ethnicity, this is all identified by government documents. So this is not necessarily chosen by the individuals. We do, in our data analysis, if someone identifies as transgender, they are included in the sex or gender that they identified as. So in terms of sex and gender, we had 7 victims that identified as female, 17 that identified as male. In terms of race, 21 identified as white and 3 identified as black, which is also still disproportionately impacted. Race is disproportionately impacted in overdose deaths. In terms of substances, so I'm sure many of you have heard of fentanyl and the fentanyl epidemic. It is still the leading cause of overdose deaths in our community with 11. Methamphetamine and cocaine and alcohol still remain the top ones as well. You may wonder what parafluorofentanyl is, and I can't believe that just rambled off because usually I struggle with it. It is a synthetic opioid, so it is still related to fentanyl, a fentanyl analog. And you can talk to someone much, much smarter than me about exactly what that is. But these are what we're seeing in people's toxicology. We also know that people have multi-drug toxicity. So, with fentanyl, we have heard, that it is in other substances. This year, it is primarily just fentanyl and not as much multi-drug, but we still worry about that with non-fatal overdoses. In terms of the age, this does look a little different than last year. Last year, the primary demographic was 18-year-olds to 44-year-olds. This year, it's 35 to 64. I also want to add kind of the stigma piece that a lot of times people think that the stigma of addiction does not impact older folks, but we are seeing in our older generation that they are struggling with addiction. In addition, we have seen with non-fatal data, which is much harder to capture, that we are seeing younger populations, which we focus a lot on youth prevention as well. In terms of where this is happening, City of Oshkosh is still number 1 in terms of the death rate. I will say all of these numbers are down, obviously, because we've seen a decrease. But this is important to us when we're talking about different interventions and programs, where we're spending our time and focus on to make sure that we're making that impact and saving people's lives. Okay, so with all of this data, this graph is, obviously too small for you to read, but I want you to be overwhelmed, because I always say I'm overwhelmed by this because this is my job. Beyond reviewing cases, we really focus on the action piece. We are not a group of talk, we are a group of action. So each one of these ovals is a committee or a task force that is implementing some of the recommendations. In the last 7 years, we have implemented over 55 recommendations and 12 different projects, and I'll get into some of those. But really, it's looking at, on the left side, what we're focusing on of childhood trauma, mental health, talking about those resources in our community to help people. We talk about prevention and harm reduction. We're very involved in the recovery community. Communication, wow, that's a struggle. Communication and engagement, and then social connectedness. So making sure that people don't feel isolated and feel that they belong. 3 different programs that I just wanted to highlight that I think are really important, especially to the connection to Oshkosh. So the Handle with Care program, I had mentioned it earlier. It started in 2020 between Oshkosh Police Department and Oshkosh School District. And this is a national program mandated in some states. So the state of New Jersey mandates this. But what this is making sure that anytime kids have contact with law enforcement, that they are supported on the school side. The main thing we want to do to save people's lives is to reduce childhood trauma. We know that kids are experiencing trauma on a regular basis, so figuring out how we can wrap around support. Since 2020, we have made this a county-wide program now, and we've had 2,113 referral to care and support. Another program that you may have heard about, which is an incredible asset to the city of Oshkosh and throughout the county, is the Solutions Peer Response Team. So we started this in 2022, really empowering and lifting up our recovery community to do what they do best. So we have recovery coaches that work 24/7 to connect people who are struggling, to support their family members. We have an incredible program in the Winnebago County Sheriff's Office jail, where people who are stuck there for whatever crime has been committed or whatever instance they're in there, they're getting the support that they need and getting programs and opportunities to turn their life around. And then the third one, which I'm most proud of by the shirt that I'm wearing, is our We Heart You program. And our motto there is to break the silence, reduce stigma, and save lives. So I just want to dig into this a little bit too, because I know so much of the work that you all do is breaking down stigma and connecting people and education. And so with this Winnebago County Overdose Fatality Review, that's not a term or a logo that you want on a shirt that you're sharing with people, because it represents a lot of hurt to people and a lot of grief and a lot of sickness. And so we came up with this idea of We Heart You, just telling people that, hey, you matter. We care about you, and it doesn't matter how many times you need to get better, we're still a community that cares. So the way that this first started was actually, and I love to give shout outs, UW Oshkosh Chief of Police Chris Tarman, and it was really his idea. And I tell this story, I was able to do a TED Talk about this in the fall with it, but I tell his story about how he came to this meeting and he was so struggling with another person who had died of missed opportunities, that we just hadn't reached him. And he said, what if we just tell people that, we love them, we care about them, and we're like, okay, that gets a little too lovey-dovey, we can't do that. But what about We Heart You? This idea that it doesn't matter who gives you this resource card, and it's probably not the first time or the second time, but it might be the 12th time that someone gives you this card. So we've expanded it far past, law enforcement giving a card or social services giving you a card, but we've done a lot more. And one thing that we did to really dig into this, and once again, something I know this committee cares about, is people who've been through it and hearing those perspectives. So we've spent a lot of time in the recovery community, asking the recovery community their thoughts about the work we're doing, making sure that it's relevant. And one thing we did was summer of 2020 community conversations, where we met with a lot of people who were in recovery and asking them about how we could better support them. And the thing that we heard loud and clear was bridging the recovery community with the broader community. We sat with 2 young women that were very new to recovery, and they said, I wish people just knew how great recovery was. I wish people knew that, we were sick with the disease, and I wish more doors would open up, and we're like, well, we can do that. And so out of that, we created so much more. We've created an event that we hold every 2 years. We created the app. So we took that resource card and knew that not everyone has access to a card. Not everyone's to use it. But with this app we created a couple of years ago, this has resources in Winnebago, Outagamie, and Calumet County, and it's all around substance use and treatment resources as well as basic needs. But my favorite part of this app is meeting people where they're at. And it's that feature that says talk to someone. It's a red button right there. You can call, text, chat, and there's someone there 24/7. And so it's not just people who are struggling, who are using drugs saying, I'm ready for treatment right now, where can I go? It's people who are looking for housing. It's family members that say, I just picked up my loved one from the jail for the 5th time and I'm ready to lose it. How do I get them help? And it's people who've been through it that can share their story and say, let's walk through this, right? Let's give you some of those steps. So it's an incredible resource for our community. So where we're going, and I say this with a little asterisk of, we'll see what happens with funding, knowing that lots of things are changing. We still have so many partners that are committed to this, and we hope that we can do this for another 7 to 10 years. But where are we focused on, and where are our partners? And it's really around 3 things. There's so much we're doing, but the first is closing those gaps in communication between systems. We know people get stuck in between. So say they're released from jail, and there isn't a sober living facility for them for 2 weeks. Where do they go? We know that people may have had a non-fatal overdose and end up in the hospital, and then they're released. Where do they go? Thinking about all those different opportunities. And so having all these partners around the same table and talking about how can we strengthen this to make sure people don't fall through the cracks is a major priority for us. The other one, and Chanel, I know you're part of this work, as are many others, is around childhood trauma and really identify children falling between gaps. We're trying to focus our efforts on many different initiatives, thinking with those root causes. Right now, our work is focused on elementary school level and meeting them at their basic needs to reduce that childhood trauma. And then the third one is focusing on preventative efforts. So we know there's this huge continuum of people who struggle with addiction and substance use disorder. So kids who are early on, who may be in a home that are struggling, or maybe using drugs, or people in recovery. And so how to support all those people, but really knowing that we have to focus on preventative efforts if we want to end this cycle. So I always want to end with a slide of what you can do, because I think people get overwhelmed with all the different things. So I offer these up because I think they're easy and they're tangible. The first is to download the app or to share it. I love that you said that people in your work didn't know what it was, and that's the first thing. I have gone places in our community, seen people at a bus stop who might be struggling, and I say, do you have this app? And they're thinking that I'm a crazy lady, and I'm like, I am, but here's my hand. We can walk through this together. So the app is an incredible local resource to share with others, and such an easy way to give people help. The other is to inspire and to spread hope. So I think that sometimes, once again, this work is so heavy and so hard, much like everything you're doing, and it's hard. We lose hope very easily, and so we have done some incredible events, worked with Mirrorless Productions to create some incredible videos, and so I hope that you watch those and share those with others too, to keep up that hope. Our website, weheartyou.org, has a lot of resources and videos and pictures and stories as well. We highlight people who've won awards that we've given out, but really focus on the work that we're doing, so I encourage you to get educated. Narcan, I love that we already had a conversation on that. With fentanyl being the leading cause of overdose deaths, we need Narcan in our community. There are lots of ways that you can get it, but the greatest resource, I say, is our public health department. You can get free Narcan from their office or with the public health vending machines. The information's there. Talked about the Solutions Peer Response Team. I can't emphasize enough how important it is to work with and talk to people who've been through it. Not myself, people who have lived through it, that can talk about the struggles but can talk about the success as well. Breakwater is a great organization focused on youth substance use prevention. I know there are a lot of people that care about that. And then the last thing that I say is, if you have the finances to support one of our local treatment or recovery organizations, they're always looking for resources, whether it's funding for their programs or they have plenty of wish lists as well. So with that, I say thank you so much for giving me the opportunity to talk about what we're doing with the OFR team. And if you have any questions, I'm happy to answer them as best as I can.
The one thing I will say, because I was at the 2024 We Heart You event, and Vin Baker's speech, if you've not watched that, there's and I know in my upbringing, addiction was somebody else's problem, was their problem, was people that, were economically disadvantaged or experiencing low income, that's what, and you hear this NBA superstar who was making millions and millions of, addiction, the disease doesn't discriminate. And his story is just amazing.
It was, and I loved walking away from that, and people said, oh my God, his story was so relatable. And I said, did you hear how much his contract was? But people were like, that's my story. And so I think, addiction brings people together and divides them. And I think that We Heart You is such a great way to show support no matter where you are on that continuum and journey.
If somebody was not currently involved and wanted to get more involved in helping out, what kind of opportunities are there?
Lots of different opportunities. So there are local organizations, like I said, that you can always volunteer with. We Heart You will have an event hopefully next year. So we always need people on our planning committee. Public health always has ideas of ways that you can help too. So you can get involved in an organization, or simply spreading the word about one of these great resources is extremely helpful.
Thank you.
Yeah.
Awesome. Well, thank you.
All right. Yeah. Thank you so much for coming.
Yes,
It's great information.
Yeah.
And hopefully we'll be able to help spread the word.
I would love that. Thank you.
Thank you, Jennifer.
Thank you.
Yeah.
Thank you. Happy Monday.
Yeah. Stay safe. I hope nobody gets blown away.
I know. Thank you.
See ya. Bye.
All right. Do we have, or for the committee round table, does anybody have any DEI related activities or events in the area coming up?
Well, since we're not meeting in May, we definitely should mention the Pride event on the 29th of June, because believe it or not, even though it's April, that's going to be coming up. Yeah.
Yep. Absolutely. And there is, on our DEI page, there is a volunteer sign-up sheet through Google's Doc that we did share. So the Oshkosh Pride 2025 volunteer sign-up is out there if anybody is interested. Again, if you don't know where else to find it, you can check out the City of Oshkosh DEI Facebook page. So I have a few more, unless anybody else has some.
Mine are related to city councils.
Okay, well, we'll get there. So there is a nonprofit workshop on Thursday at 8:30 a.m. In person and in Appleton, DJ Bordini Center. There is a fee for that, but if anyone is looking to do a nonprofit, this is definitely something that might be very helpful for people. Volunteers are needed for, veterans. We'll be placing flag on veterans' grave sites. So there's also a veterans needed for Saturday, May 17th, 8:45 to 1 p.m. There's also a rain date. There's a phone number to contact Donna at 920-236-5092 if you want to help. And again, if you want to see that flyer, we did share it on our City of Oshkosh DEI page. Let's see. On Friday, May 9th at 5 p.m., there's a Smashing the Stigma Mental Health Matters, 927 Oregon Street. Do you remember who's hosting that?
Mm-mm.
Okay. I don't remember who's hosting it, but
What was the date of that one?
on Friday, May 9th, Smashing the Stigma, Mental Health Matters, and again, it is on our website, but on the Facebook page, but I didn't obviously screenshot a big enough thing to see where it's exactly being hosted. May 24th is the Hmong National Memorial Day Festival for 2025 here in Oshkosh, May 24th and 25th. So I know
An amazing celebration.
it is an amazing celebration. So that's all of a sudden it's there's events coming up because it's getting nice out. So I think that is everything that I took a picture of this earlier today to make sure I shared with the group.
I did think of one. Go to SAPO is Hope on Facebook. They are running one of their literacy programs right now, and they have the updates every single week. So they've done 4 weeks of their newest literacy program with Dr. Sam Coleman from the school district, and just following that it's an uplifting read as they continue that journey.
Wonderful. Anybody got anything else?
Any outstanding items? I think this is where you come in, Carl.
Yeah, I wanted to call this out. Our new city manager, Ms. Grill, brought us a resolution urging the Joint Finance Committee to fund municipal services payments at 100%. So that started back in 70s or 80s. That is for the land that we operate for the state. So the hospital, the prison. We are supposed to be reimbursed at 100% of that, and right now we're being reimbursed at 37 cents on the dollar, which means that from an equity standpoint, the Oshkosh City is picking up the tab for that pieces. So you should be able to look at any city councilor on there. I think we all shared it, but email your state representatives right now because it's their budget season. They need to hear how important it is, not just for the Oshkosh community, but surrounding
All communities.
all communities. And with the state sitting on a $4 billion surplus, not funding the local municipalities is definitely not to be a cool trick.
Thank you, Carl. And then future agenda items, just a reminder that May's meeting is canceled, and then our June presenter is also going to be SAPO that Carl was just talking about. Does anybody have anything else?
I have a couple more things. Also, our annual reorganization meeting is in June. Basically, that's where we elect a chairperson and a vice chair. Obviously, with some changeover, we've had elections other months of the year. And I also wanted to mention that this will be Liz's last meeting since she has her term is ending and is not going to be renewing.
Not approved.
What's that?
Not approved.
Not approved. And of course, our May meeting is canceled, so this is it. But we want to make sure we thank Liz for the time that she has spent with us and really appreciate her contribution, which also means that there will become a vacancy on the DEI committee for anybody who might be listening who might be interested. You can apply on the City of Oshkosh website for our boards and commissions. Not only is DEI looking for members, but there are several other boards and commissions that are looking for members as well. So, thank you. Gotta put my little commercial in there right away. So.
All right. Do we have a motion to adjourn the meeting?
So moved.
And a second?
I'll second.
All in favor?
Aye.
All right, thank you.